Hi, I'm Drex DeFord, a recovering CIO from several large health systems and a longtime cyber advisor and strategist for some of the world's most innovative security companies. And now I'm president of This Week Health's 229 Cyber and Risk community, and this is UnHack the podcast, a mostly plain English, mostly non-technical show about cybersecurity and risk and the people and process and technology making healthcare more secure. And now this episode of UnHack the podcast.
Hi, everyone. I'm Drex, and this is UnHack the podcast. And with me in the virtual studio today is Chris Plummer from Dartmouth Health. Hey, buddy. How's it going?
Hey, I'm glad we finally made some time for this. You're somebody that I have corresponded with for an awful long time. And we've never actually been introduced in person. I think across two different health systems that I've worked in, I've known your name. You've been kind of a fixture in healthcare cyber for a very long time. So I'm just excited to get some time with you today.
And same here. I think in a lot of ways, the mutual fan club here, you're super famous. I feel like I know you because we have messaged back and forth several times, but I listened to you on Ed Gadet's show, Risk Never Sleeps, and you guys had a great show. And so for folks who are listening to this, if you haven't listened to Ed's podcast, you should, especially the one with Chris, because it really is like you're in a pub and you're just kind of sitting at the table next to a couple of people that are just kind of goofing on each other and talking about a bunch of, really obscure stuff. You guys go down the road on like music and a bunch of other stuff. So
that's what we plan to do. I think after the first time Ed and I talked, which we were mostly talking shop, and then we vowed we would talk again. And then there might have been 10 minutes of actual healthcare cyber talk in our second episode, but it's worth it if you can just hang in there. It's stitched in.
So you have a really interesting background and career, and I have a million questions for you, but
okay.
I'm sure we don't have time. So come on the show again, but I'm sure we don't have time for a million questions that I want to ask. But let's start. I want to see what you bring up about your background, and maybe we'll riff on that a little bit. You're not the kind of guy who woke up at 11 years old and said, oh, I want to be a chief information security officer, or I want to be involved in cybersecurity. Like that wasn't a thing, right?
Yeah, so cyber was not invented when I was 11, of course. I've always had an interest in computers, which goes way, way back to like elementary school when I learned how to sort of game the education system in my both elementary and junior high by plowing through my work as fast as I can. And my teachers weren't sure what I should be doing once I finished my work. And so they said, sort of by default, there was a computer in the corner of the room. They're like, well, you can go use the computer. So that started in first grade on a Commodore PET. And I ran the table probably all the way through seventh grade, doing that same thing, just blasting through work, just so I could get time in front of a computer. And so that sort of just love of technology has always been with me, which maybe that's this need to want to protect technology is sort of how I've come to wake up every day and do what I do now for hospitals. Yeah, no, security was even in my first sort of serious infrastructure role, which was right out of college, sort of being the technologist for a .com. That was a fun time in the 90s. You were standing up all this infrastructure to support this frenetic pace of business. And so we kind of secured it. I think we did. The thing that was apparent to me is that I didn't know anything about security, Drex. Like I knew that I was creating future problems. And so we were really lucky in that organization. We had really deep connections to GTE at the time. That's not an entity that's around anymore, but we had some managed security services through GTE, which I found to be very necessary. I didn't know anything about running a firewall. I knew someone else who did know how to run a firewall, had to do that job for us. And so I've just been keenly aware of what I don't know, I think my whole career. And that is, I think, healthy paranoia. I feel like that's kept me out of a lot of trouble. Trouble still finds me just like it finds anybody else, right? There's nothing you could do about it. But yeah, it really wasn't until I went to work in support of US Navy for a little over 10 years. I was information systems and security manager.
Yeah, so we've got some overlap there. I'm a retired Air Force officer. We did DOD stuff for a while. That's a good time, right? You enjoyed that?
Yeah. If anything, you know exactly what you're supposed to do, Drex. I think that's the moral of working in service of the government. It's not ambiguous. You don't love it. I truly burned out of that job. I've mentioned this too before in other conversations, but probably like 3 times where like serious burnout, where I have a hard time getting out of bed. I can't will myself to go work on certification and accreditation activities, which I'm still very involved with here now.
Was it the stress involved in the job, or was it just like
Yeah, I was being the only one, right? Which just seems to be like a role that I continued to fall into for a long time, being the sole chief technologist, probably for like 3 or 4 jumps after that role. It's just exhausting bearing all that operational responsibility and then the responsibility of securing something and then bailing the organization out when something goes wrong. And then fast forwarding to my first work in a health system, I was the only cyber FTE for a number of years. And then I came here to Dartmouth Health, where I'm fortunate to no longer be the only cyber FTE. It's an amazing change of pace in this country's 6,000 plus hospitals. That's very much the state of affairs, right? Even if they have a cyber FTE at all, even a part-timer, it's a huge spectrum, I think, as well.
Yeah.
So
it's really interesting to look at. If there's 6,800 or whatever there is hospitals in the US, if you go to the bottom half of them, there's a lot of places that I've been where you sit down with presidents of those hospitals and they talk to each other about, how did you talk your board into giving you the money for a second IT person? Like literally those kinds of conversations that just show the broad range of resources and lack of resources that are some of the challenges that I think we're all facing right now as a country.
yeah, and that's so as a country is an important phrase. Improving that status quo is why I became a member of the Health Sector Coordinating Council now like 5+ years ago, knowing how hard it is to fight in the trench for an HDO.
Yeah.
I had relationships in federal government, federal agencies where I knew if I could be inserted to help inform federal healthcare cyber policy, I could make life easier for myself and many others, which is something we in the council have been tirelessly working to do. But I will say this too, just I've never understood the biggest adaptation that I had to make coming to work for healthcare was just understanding how isolated you are and how you solve very basic problems. And so I always liken it to the NMCI project back in the days that I worked for US Navy. And so this was a consolidation effort that Navy Marine Corps underwent, where at the time, and this is like 15 years ago or so, every naval installation was sort of defending their own perimeter, their own independent network stack. The stuff that was running here locally, I worked here at SubMep activity, which is submarine maintenance activity here in Portsmouth. They're running network equipment that was sourced like locally from here, a company here in New Hampshire. Like that stuff's not in San Diego. It's not in Pearl Harbor. And so among a lot of other inefficiencies, Navy Marine Corps decided, hey, if we corral everyone through a common stack, and it's not going to be one hop away, right? And so that was a big adjustment for people because they were like, well, I want to go to a server in the next room, but I got to go to Virginia first and come all the way back. It's like, well, yeah, you do. But you understand, like now, there's a huge lift off your shoulders right now. Like there's a whole lot of like operational stress you don't bear anymore. And so I feel like DOD, I can't speak for other aspects of DOD, but that corner figured things out really fast. And I've always wondered, why does that model not exist for national healthcare? Why are 6,000 plus hospitals still like waging independent
for the independent fighting against nation states, right?
Yeah, and it's not even pride. It's not like, well, I want to do that. I want to have my full control. It's like, you know, I'm up against powers I can't fathom at a scale that I can't fathom. So that's maybe an aspiration through the work we do in HSCC, hopefully other groups, like-minded groups, that we're driving toward an objective like that, where I liken it to this Marvel. You're going to get tons of Marvel references from me because that's just what I do.
I see on the wall behind you.
But this concept of Ultron, which was this like suit of armor that Tony Stark wanted to wrap around the world. And of course, it didn't work out very well in that movie. Famously, like AI turned against him. But that's not, we're trying to avert that outcome. But we want this suit of armor. We want this suit of armor around all of healthcare. And as a health system, we are comprised of, I think it's like 11 system members, or we call them affiliated organizations, 8 of which are full-blown hospitals, a number of clinics that are the size of small hospitals. So as we encounter these new relationships with other organizations, I'm helping to put this suit of armor around those organizations. And those of us on the security team here at DH work incredibly hard to make this work. Because when we combine forces with other organizations, the security piece can happen fairly quickly and efficiently. And I also feel like it's just such an incredible bang for buck. Of course, the business operations, clinical side of hospital, like that's a years-long integration effort. But the security side of things, lots of hard work, but can happen super quickly. And it just puts that suit of armor around them that you want to put around everybody.
It really does turn up the volume, especially. So I know, I mean, from you, but from other people too, it feels really good when you put your arm around another hospital that comes into the network and you can provide that level of protection really quickly. That is a good feeling too. It's great for patients and families. It's good for the people that work there. It's good for they're referring patients to you and you're sending them back home.
I feel that lift off of their conscience too. I really do when we were able to activate certain aspects of our defense. And I feel really good about that. It's exhausting for the business to continue to affiliate with new organizations. That whole model of healthcare that we're in right now, it's a whole other conversation, whether is that how healthcare should work in America? Should it just be this progressive growth of health systems? I don't know how else it works, at least from a cyber perspective, Drex, especially the advent. We're going to use the tired phrase AI over and over here.
Yeah, let's talk about AI. What's going on with AI?
It's the great force multiplier, right? That's the asymmetry is incredible. We just, from a cyber ops perspective, and we have fantastic security partners, but they're pinky toes in AI right now. And every anecdote you read online about AI hallucination and inaccuracy and training the model properly, and I think that pervades every aspect of AI, no matter what you're using AI for. And so it's clearly not at a point where it can practically augment cyber operations. Personally, I think the state of affairs for AI and cyber right now is it could make an awfully good. The word co-pilot is interesting because that's been branded, but
yeah,
an AI co-pilot for a cybersecurity analyst, let's say, could be incredibly powerful. Something that guides a decision-making process, but is not entrusted to making decisions. So I think that's where AI is at right now, where we could reliably at. Like, of course, we all have that dream that it's just on, full-blown autopilot and
turn it over to the AI and let it go.
Yeah, making detections, and which is probably going to be a tough proposition, I think, for HDOs, no matter what. I mean, I wonder what SOAR adoption in HDOs really is, because there's just the patient safety considerations are so deep, impacting clinical operations. It requires such a deep understanding of the user, like understanding identity. Who is this person? What is their role? What are they really practically doing right now to inform a choice about taking an action on the system they're using or the account they're using? I think that level of enrichment is so complex.
We start where we can start. Part of this too is I feel like, see if you agree with this, there's a little bit of an unrealistic expectation for AI in that there are things that we do today that we suck at, and then we add AI and we expect AI to suddenly be perfect. But when it's 80% better than us, sometimes our resistance is that it's not perfect enough yet. And so there's okay, cool, but it's way better than we were just on our own or not doing it at all, right? There's some advantage to the AI. I'm with you. I think this ultimately has to come back to the person, has to come back to the SOC analyst or whoever it is, if that's the kind of AI that we're going to start with or that we're going to use. Get the AI assistant to help us. But I don't feel like it has to be perfect. I think that's all part of the learning training process too.
It's hard because on one hand, the institutional knowledge required is so deep, but the rate of innovation is so fast. I can't pretend that in a year from now, some of these problems won't be solved. Some of this stuff happens and it feels like it's in the blink of an eye. So
we started using GPT. When did we start using ChatGPT? 2 years ago?
Yeah, I've been paying for it for 2 years. Yeah.
And it's ridiculous to think about where we are right now. I just did a keynote at Portland HIMSS, and the whole keynote was about the North Korean fake employee problem and the technology that they're using now in Zoom calls to make the person in the Zoom call look like the person on the ID that they've actually turned over in the job applicant process. But in fact, that's not the person who they are at all. And they're running through a laptop farm that's run by a U.S. citizen laptop farmer somewhere in North Carolina. So they've got a local IP address. How far it's come so fast is amazing. And then just in the last couple of weeks, we've had the Google VO3 stuff come out, and you can make motion picture quality movies just with prompts. It's crazy.
Yeah, the arts will be a hard sell, at least for me. I love Broadway, for example. That is a live show. That's happening right in front of you. You will not replace that. You will not synthesize that with AI. So maybe that's why I like that so much. I've been to many shows in New York, and it's like I can't get enough of it. Maybe it's the reality portion of that experience in the face of all of this automation and AI that we're sort of fighting off in other parts of our life. I do agree with that sentiment that maybe, yeah, 80% should be good enough. I just wonder, even like last night, for example, I found this photo of an old car in a parking lot. And I knew it was an Audi, but it was very old. I didn't know what it was. And so I threw it into ChatGPT and said, tell me about this car. So it made all these assertions, but it's so confident, Drex. It's so confident. It had this license plate. It was, okay, so the car was an Audi Fox. It's a wagon. It's a station wagon from the 70s. It's super cool looking. And the license plate said Foxy, which is like, okay, that's clever. And so ChatGPT was convinced it did not say that at all. It like doubled, tripled, quadrupled, quintupled down on what it thought it was. It was flat out wrong. And then I said, like, I'm going to bet you $1 million, your answer and my answer. And then so it, like for the sixth time, it
went in again.
It was absolutely wrong. And then I gave it my answer, and it was just completely humbled in whatever language the ChatGPT tries to use. But I think until we can distill that bravado out of these models, like, I don't know.
I feel like there's a dial. I think there's a dial in there that we have to be able to tune. And like, you need to be a little more humble. It's possible that you could be wrong.
Humility.
Yeah.
I'm still happy to use it for troubleshooting though. Like, as I was saying before, like providing a series of, let's say, like 5 steps, 5 things to check if you're trying to solve any given problem, because I do appreciate that about it. If for nothing else, I like throwing random problems at this thing that's not going to judge me for asking it questions, no matter what it's about. And it's going to be overwhelmingly pretty positive. Its attitude is never really going to change. I do want that for us. But I want that multiplication of force for our analysts, though, of course, because the signal volume it's so large, and there's no practical way, we'll never staff our way out of it.
This is another one of those, like, is there a better way? Instead of us all staffing individually, is there some kind of I went through the same kind of program in the U.S. Air Force, right? When I took over as a regional CIO, I had 14 hospitals, and they were all completely on their own. They bought their own stuff. They sourced it locally.
It's amazing.
They bought 12 PCs at a time, and they paid a premium because they never knew when they were going to get those PCs replaced. And I pulled all that money back to the major command, and I actually started buying things centrally. And we were able to get so much more stuff just by doing that and standardizing and securing and doing those kinds of things. But we do it in our health systems today. There's got to be a way to scale that to we're like thinkers in that we've had this experience in our past, but we just can't get to kind of a med net or something like where all hospitals connect to this thing. But there's when you're connected to MedNet, you're at least this tall to ride the ride.
Yeah.
And it provides some level of reasonable security and connectivity.
I don't know why we wouldn't want that, Drex. And this has eluded multiple administrations, right? I don't even know you can't pin this on anyone because it's just this can has been kicked for decades. So it's the right advocates at the right time will reach the right audience. And that's what we hold out for, I guess. That's why I'm still in the seat, hoping that day comes. And then we all, I don't know, that's the end of the movie for us. I don't know.
Congratulations, you got it done.
We have so many other just structure. I mean, even like breach notification, for example, let's say something has gone wrong. How do we all know something has gone wrong? Every time we hear this pervades the news, this pervades the information products we consume. Another hospital suffering a security incident, or perhaps we know it's ransomware. Perhaps we don't know that. The first thing we all do as HDOs is scramble to understand what's our risk profile look like now that we know that this potentially.
Maybe we know, maybe we don't know. Everybody lawyers up too, or kind of like a lot of.
And I understand that well. I mean,
I
get that, man. I've been through so many of these, and I understand the legal implication. Cyber insurance is that first call, and then they drive the truck, and it's like you're just hanging on. I get it's frustrating, but I cannot help but feel like in the HISAC, for example, which I think is a great representation of where all HDOs are at from an intercommunication perspective, we all ask the same exact questions in HISAC every single time some hospital is suffering. What's going on? Am I concerned? Do I need to do one of the rinse and repeat 5 things that I do every time someone's breached. Do I turn off my VPNs with them? Do I sever remote access? Do I cut off their email? If they have local accounts, do I shut those off? What other sort of interfaces do I have with them? The sending medical telemetry, do I have to cut those off?
Is it a third party?
I think the legal piece of this is always going to exist, but there's very much a patient safety aspect to this that I think needs to take some precedence over the legal characteristics of the situation, such that hospitals can know, okay, I don't get the exact answer of what's going on the ground, but I don't need to know that. I just need to know, yes, it's okay to keep sending and receiving email with this organization. Yes, it's okay that I keep sending analytic laboratory results, or I can continue to get x-rays from this place. I can continue to keep my conduit between my EMR and their EMR going. Everyone desperately needs to understand that state of affair every single time. Like, we're all searching for those same answers. It consumes so much oxygen in the room, just trying to understand. So we're all doing the same thing. We patrolled news sources. We're looking at social media. We're trolling Reddit. Just, it's wild.
That this is what we're doing to try to get the intel that we need to make decisions like that.
Yeah, it's another illustration of HDOs all still on an island and fighting their own battles. And again, you're not going to get ahead in the information war without people. So you're losing on all fronts if you don't have the personnel, right? You're not securing your house. Like, the windows are still open. You're not getting the information you need about your third parties.
A big part of this is building networks between the people who work in those health systems too, right? So that you're comfortable in sending an email or standing up a conference call and getting 5 or 10 people that you really know and trust on the call to troubleshoot this together and all alert at the same time, or see if you can get some intel all at the same time. That's got to be a big part of it too, instead of doing it all serially.
Yeah, I mean, so regional information shares can help in that. We have a pretty good one here in New England. We might be 50 members strong, I think, at this point. I'm not sure, 30, 40, 50. Of course, the HISAC, which only Earl Weiss can tell you exactly how many HDOs he accounts for, but an awful lot of them.
Yeah.
We lobbied for that too in Sector Coordinating Council, just getting some kind of universal access to an ISAC for HDOs, because that is such a powerful information share. And it's not that HISAC, for example, is expensive. It's an entity that has operating costs. It needs to be subsidized. The federal government doesn't subsidize the ISACs. But still, it's a budget line item for a critical access hospital that's barely making anything work, who's just like hanging on the rubber band of Medicare reimbursements like every hospital is. And it's like, which piece of my stack can I really invest in? Okay, hopefully you're investing in EDR, because EDR is going to make or break the organization. Yeah. And it's kind of a weird paradigm when you're in a very needy hospital like that. From a cyber point of view, you've got to build from the endpoint up. I don't think there's any other practical way to do it.
And there's a lot of tough decisions at those level of organizations too, right? Do I buy an EDR? Do I repair the leak over the emergency room? Do I replace the broken MRI? A lot of these are like, there's a no-win situation going on at a lot of these facilities.
Yeah. Do I run the 20-year-old MRI still producing images that are pretty good? Yeah. It serves our purpose, but it carries a lot of baggage that I can't see and I don't understand. Boy, I wish we had some more optimism about the situation.
I was just going to say, I'm going to shift gears. I'm going to ask you a couple of other things that I kind of want to know about. One of the things you have in your LinkedIn profile, or something that I've read that you've posted, is about saving Google. Can you tell me that story?
I was on my way to karate class, which I've been a martial arts practitioner for not quite 10 years now, but I'm a second degree black belt now. At the time, I was training for my first black belt, and I was on my way out the door to class, and I got this really peculiar email. At the time, Google had just rolled out this feature, this sort of blue check mark of authenticity.
For the senders.
Yeah, you can imagine there were like 2 billion Gmail users. The spectrum of ability is incredibly wide. And so they had this really noble idea that they would use this standard called BIMI, which is underpinned by a couple of other email standards, to basically assure you, the user, this email really came from the place you think it is. You're not about to get scammed by clicking this link or calling this number, so on and so forth. So anyway, I have this message in my inbox with incredibly strange sending address, but it's got the blue check, which I had never seen before, because I think at that point it had only been a couple weeks old. And it was from UPS. And so the message had this UPS logo in it, in a place that the sender can't put it. It actually appears in the Gmail UI. And I was like, this can't be right, but I've been wrong before. So I'm going to class. I'll deal with this one. I come home and I can't stop thinking about this thing all night. And so by the next morning, I'm sure this is a bug.
Yeah.
Which is a crazy thing to even come to terms with, because you're like, did I just find a bug in a Google product?
They're also smart and there's millions of them.
And I'd never fought that fight before. And so, but by that morning, like I woke right up the next morning and I just threw it all together and submitted it to their bug tracking system. And probably by the afternoon, they were like, yeah, this is working as designed. This is not a bug. And I had been going through email headers like all day long. I was so sure. And then
you had to go fight this battle for a while, right? To get
but I had friends though, because that night I went to Twitter back when Twitter was really sort of probably at the apex of Twitter, or getting there. And I was venting on Twitter about it. I get tons and tons of support. And then it was this amazing cascade of attention to this bug. And it got Google's attention. Google changed its mind. Like that tweet was at like 9:00 at night. And it must have been sometime the next day. It reversed course.
And you kind of almost broke Twitter because of that, right?
It went wild. Yeah. It was like every media outlet on earth was covering this story, and it was in like Apple News. So it landed on every iOS device in the world, and it landed in some Microsoft News applet that appears in every Microsoft operating system. And I did interviews and such, and I was in the local paper, which is the proudest thing. My family got to see that.
Did you tell your kids, like, see, I'm kind of smart?
Yeah, I was on our local news, and my daughter was down there at the local news station with me that Saturday morning. But yeah, that was amazing, not just because of the media focus, but there was a substantial infrastructure change made by Google because of this very quickly. In fact, they turned that feature off. Like for the rest of that week, it was off while they tried to figure out what the heck was going on. There were also a number of other cascading failures, like UPS, for example, had a serious flaw in their infrastructure. They changed that very quickly. Microsoft did, Yahoo did, Apple Mail did. Like these are things that came out of the woodwork in the months after. It was an incredible series of things that sort of shook out of the tree from this. I went to a party once locally, and they're like, "Hey, are you the Google guy?"
We're almost out of time. I'm going to ask you about one other thing because it just happened recently. So the switch from Twitter to Blue Sky, and then you just posted something on Blue Sky that kind of went viral too, right?
I saw
the big surprise, like, hey, I didn't realize that was happening that
was Blue Sky has really gained some traction, which is great. It's really hard though, Drex, I would say, to find time for social media in this line of work sometimes, which is why the thing I posted on Blue Sky was at like 6 a.m. on Saturday.
Yeah.
But I was lucky enough to catch early showing of Mission Impossible. And so as I was just sort of scrolling through news, and there was a teaser for a news story about whether or not Mission Impossible had a post-credit scene. And so like any good nerd, I first analyzed the page in URL scan to understand all the HTTP transactions I would be signing up for if I clicked this link to learn something I already knew because I watched the movie.
And you watched the trailer.
Which didn't exist, which it wasn't a thing. There was no trailer, but it was like an overwhelming response to how dirty the web has become. And then there are not a lot of great analytics in Blue Skies to understand, like, why did this explode? Why did this go crazy? Why has this been seen? It's been reposted, I think, almost 5,000 times and liked 15,000 times. And the metrics come out to something like 4 million views, I think, or something. That's obnoxious for something so stupid. But you have no way of really knowing why it's amplified like that. It caught wind, but I think it really just told me, like, no one's happy with the state of the internet these days. Like, I grew up with the internet of the early 90s, as many did. I've seen a huge swing of evolution. I was really lucky to help author the very first textbook on the internet at the University of New Hampshire in the 90s, while I was still a student, which was crazy to walk across campus and kids are like carrying a book.
But you helped write.
My wife, who I met at college, actually took that very class with that textbook, and I was very helpful in her homework, but
she was like, I know that guy.
Like, I wrote that homework. But about a visceral reaction to the way the web works and the way the web is commoditized. And it's been I get pinged on my phone by that thing like all the time, as you can imagine. But it's heartening. It's like, oh, okay, I feel at one with a piece of this universe. And that's been just priceless. Because
people so I feel like we've maybe crested a hill here a little bit where people gave up a lot of privacy using the internet, using social media. And maybe now we're starting to, as a public, understand how much privacy we've given up and how much advertisers and the government and everybody else knows about it. Sounds super paranoid. I am a little paranoid too, but
That's the nature of
maybe
it.
that's why it's gone so viral, is that people are starting to look for that kind of information. Like, it's actually triggering.
I think they're exhausted too. I think they're exhausted at the kind of countermeasures that you need to employ to maintain some kind of privacy. And so good. And I think it's clearly generational. We did not see this until, I don't know, the Zs. Is it the Zs who are most vocal about this? The Gen Zs? I don't know.
Unintended consequences, I think, of some of our early internet actions and implementations. Tools evolved over time, and suddenly it became, not suddenly, it was an evolution over time. It became what it is today.
But that world, Drex, is very crafty.
Yeah.
And they will find a way. Web advertising is such an incredibly, I don't know how to frame it in a positive way, but it is fascinatingly complex. And they will find a way. They're incredibly brilliant people who work on these things that we very much don't like about our internet experience. They will find a way to overcome whatever we think we're going to throw at this problem. So that's just another one of these eternal struggles I think we're in for. But that was that was like my first big blow up on
big blue sky.
Blue sky. So yeah.
Hey, listen, I'm out of time. I'm disappointed in this, but I am. Come back, do this again at some point down the road.
I have pages and pages of things to talk with you about, Chris. It would be so fun to do it again.
I would love that. Chris Plummer from Dartmouth, really appreciate you being here on UnHack the podcast.
It was my pleasure, Drex. Thank you so much.
That's a wrap for this episode of UnHack the podcast. Do me a favor and share this episode with your peers. And by the way, your feedback matters, so please subscribe and rate and leave a review wherever you listen to podcasts. I'm your host, Drex DeFord. Thanks for spending some time with me today. And that's it for UnHack the podcast. As always, stay a little paranoid. I'll see you around campus.